It was definitely unexpected, and I first thought it was a practical joke by one of my colleagues. I get an email asking if I would look at some images from the Columbus Zoo on a gorilla. Of course, I opened it up and I was actually surprised. Wow, there actually is a CT scan. I am a surgeon that operates on cancer, and specifically for myself, my area of expertise is liver cancer. I've never, worked on an animal, let alone a gorilla, but based on the fact that the gorillas are so similar to humans, they have, this is a very similar type of tumor that humans, especially females, develop. Liver surgery is a major operation. It doesn't matter if it's in a human versus an animal. And the most important thing from my standpoint was to make sure that the operation goes as smoothly as possible. Shalia, when I first went to meet my patient at the zoo, I was expecting a small little, like a gorilla, like something that's cute, but she's 215 pounds and her forearms were bigger than my thighs, and with big fangs as well. So. As a physician, one of the biggest satisfactions of our careers is to be able to help people. And I don't think it's any different than helping an animal. Animals have contributed so much to the advancement of the health of humans. So I think for me, it was just naturally, I just felt that it was a privilege to be able to, in return, help an animal. Biggest concern was for her to start grabbing or tearing at the incision. Dogs and cats, when they have any operation, they put that little shield there. Well, you can't do that for a gorilla, right? They're just gonna rip it apart. Whenever she's looking down at herself, she actually all of a sudden gets distracted with her fingernails. Got 2 young kids, so the last thing we wanted for her to develop was a cancer where she would not be able to be part of her family. Glad that we were able to help her.